Welcome to the Tilt's three-part series where Jesse and I are going to be discussing society and the government's role in addressing the issue of poverty in America. So the first topic that we're going to be discussing today is healthcare. Obviously, healthcare has been on top of everybody's minds for the last several years. With the passing of Obamacare and the constant struggle to reform it and change it, people are constantly right now trying to find ways to provide the best healthcare to the most people. So Jesse, what do you think should be society's role in fixing this issue?
So in terms of what society can do, one of the most popular ways that people have been using to fund healthcare bills has been crowdsourcing. So on the popular crowdsourcing site GoFundMe, 1 in 3 of their projects are medically based, meaning that people are putting out the word that, so-and-so has gotten this horrible diagnosis and they need $80,000 for the family to cover the medical bills. And people are showing up. They're providing money and giving people the support that they need. And I think really society is able to make a larger impact on healthcare coverage than the government can, because it's easier for someone to say, hey, I identify with this story, I had a relative with a similar diagnosis, let me donate $10 to this cause, versus paying a $4,000 deductible on a yearly basis for their own healthcare coverage. So it kind of spreads the responsibility, and in turn people are really actually able to pay for these medical bills that otherwise might send them into crippling debt.
From a governmental standpoint, I feel like people should not be responsible to fundraise for their own health care bills. We're one of the few countries in the world that does not provide some kind of universal health care from the government. Universal health care, while it is very expensive, does eventually reduce a lot of the overhead that we currently see. A lot of the problems that we face is because the medical bills are obviously too high. And that's coming from a lot of overhead that all healthcare providers face. And a lot of that is coming from the fact that they have to deal with who is paying for the medical bills. It's coming from insurance companies, it's coming from private citizens, it's coming some from the government. So they're spending all of these manpower hours and all of these people and money to try to figure out who's supposed to pay. Right. When if you just have a single payer system from the government, it's always going to be coming from the government. Additionally, you should not have to beg your neighbors for health care. It should be a right. There's also going to be people who are falling through the cracks. There are people who cannot make a nice video on a crowdfunding website. Right. They're not going to be able to reach out to a wealthy family member or wealthy friends or an alumni network, something like that. And those people shouldn't be penalized just because they don't already have those networks. So universal health care is going to make sure that none of those people fall through the cracks.
So when it comes to people, again, who have limited access to insurance, to healthcare coverage and that sort of thing, society really can play a much larger or more immediate role than the government can to fix those healthcare issues that might come up.
So I do understand using some kind of crowdfunding or talking to your neighbor, borrowing money, something like that, as a Band-Aid to kind of solve the problem in the immediate, but moving forward, we need to be looking for a larger solution, and those larger solutions do come from the government. So obviously, this is a very complicated issue. We hope to hear all of your thoughts in the comments. Please tweet us, like this video, vote on whether you think that society is responsible for taking care of healthcare or the government is responsible. And please check out our other 2 videos in our poverty series. Thanks.